Yeah, it's very cold. We've had
Mm.
lots of snow, but now that the snow on the ground is melted, but it's still very, very cold. But
Mm.
it's nice. It's nice.
There is a cold wave apparently. At Boston
Yeah.
also, my son was telling minus
Uh,
15.
yeah, yeah, correct. Very cold. We had lots of snow, but now the snow on the ground is melted, but it's still very, very cold. But it's nice. It's nice.
Okay, ma'am, we are on Facebook now. Sorry, YouTube now.
YouTube.
So I'm admitting all the participants now.
Okay.
Kumar, we're not able to see you completely. Yeah. Kumar, could you adjust your monitor? Yeah, great. Great. Thanks. You've met Mr. Kumar, right? Dr. Sate? Have you met him before?
I don't recollect.
Oh,
Maybe
okay.
when I visited the institute once.
Okay. He is actually the managing director at Tolani Shipping. Yeah.
Okay. Nice meeting you.
He's,
Same here. We must have
basically-
met, of course, in the Ruby clinic when Dr. Tolani was there.
Was admitted,
Yeah,
yeah.
A long time back.
Yeah,
Surely at the
22 years.
Yeah.
And we spoke yesterday.
Yes, that's
Okay.
right.
Yeah.
Hi, Rahul.
Good afternoon, sir.
Good afternoon.
Should we start?
Yeah.
So we have about 160 plus participants.
Oh,
Plus,
Good.
yeah. Plus, we have a hall full of staff
That's
in
nice.
the TMI auditorium. So I'm not sure
Good.
how many they are.
That's good.
Yeah.
So as we decided, we will have it in a mix of languages, right?
Yes. Yes. Correct. Correct.
Okay, good afternoon, everyone, and welcome to today's webinar on timely medical intervention organized by Tolani Maritime Institute. I hope all of you are fit, fine, and healthy. For this webinar, we are very happy to have Dr. Sujata Naik Tolani, Chairperson, Tolani Group, Mr. R. Kumar, Managing Director, TSCL, Principals of TMI, TCC, and Chaitanya International School, fellow teachers, office staff, and some students. Friends, for the past 23 months, since the outbreak of this coronavirus pandemic, the entire world has experienced several challenges at personal and professional levels. This virus has brought mighty economies and so-called developed countries on their knees. This situation has been very catastrophic in developing countries like India. Many of us have personally suffered due to this virus and probably lost our near and dear ones in the first, second, or third wave. All of us have been living in constant state of confusion, misconception, and threat. Oximeters and thermometers have become very common tools in our household. Many of us are obsessed with these equipment and keep taking help of these tools every now and then. And therefore, to get rid of some misconceptions, we have invited an expert to guide us what to do, what not to do in these kind of situations. Before I invite Dr. Sujata Naik Tolani to introduce our guest speaker, I'd like to inform all the participants that you will have the opportunity to submit your text questions in Q&A section today. You may send your queries at any time during this presentation. The presenter will address them during the Q&A section at the end of the presentation. Now, may I request Dr. Sujata Naik Tolani to introduce the guest speaker? Over to you, ma'am.
Thank you. Thank you, Rahul. So a very good afternoon to Dr. Prachi Sate and all of you who have gathered here today to hear some words of wisdom on a topic that is relevant and important to each one of us here. I don't think anyone is spared on this point. As Rahul said, yes, we have had the last 2.5 years being challenging, but in addition to that, even without the COVID, we as individuals and human beings are constantly faced with situations where, we are not in the peak of health, in the pink of health. And often there is a question in our mind about whether we should seek medical intervention right away, or is it okay to wait till tomorrow, or okay to wait for another week. I think this is a very important topic for all of us to understand, so that we make the right decisions, because there are times where minutes matter, where hours matter, and it is important to make timely decisions so that morbidity and mortality doesn't overcome us. It is indeed an honor to have with us today and to introduce Dr. Prachi Sathe. The year was 1999. The month was November. That is about 22 years ago. For those of you who were associated with the Tolanis back then, I am sure this timeline holds some terrifying memories. From my perspective, in 1998, I had completed a very rigorous training in the US in critical care medicine, and had been practicing in New York as an intensivist. In layman's terms, a doctor who works and runs the ICU, the critical care units. And I'd been doing that for over a year. November 99, I rushed back to India to a Dr. N.P. Tolani, who was holding on to his life by a thread. By some divine intervention, he had been delivered into the hands of this young, budding lady intensivist in Pune at Ruby Hall Clinic, who was running this relatively large ICU, meaning she was my contemporary in some ways, but of course, many years senior to me. I think so, Prachi. I'm not sure, but I think so.
Oh, no, not that. Just
Okay.
contemporary. Yeah.
Okay. You can imagine how skeptical I must have been, having a deep understanding of how critical the situation was. But what I witnessed in the ICU at Ruby Hall Clinic in those days was nothing short of the best. Dr. Sathe was running a world-class ICU. Mind you, this was 22 years ago. And I know that I was definitely well qualified to vouch for this. The rest, of course, is history. Dr. Sathe is the director of the Department of Critical Care Medicine, Ruby Hall Clinic, Pune, and a professor at D.Y. Patel Medical College of Critical Care Medicine, a professor of critical care medicine. Having completed her MBBS and MD from Pune and FRCP from London, she completed an international fellowship from Royal College of Physicians, Edinburgh, for comprehensive training in critical care medicine in 1991. Returning to India, she was the founder, she set up the ICU at Ruby Hall Clinic, which today is a 55-bedded ICU. Today, she is professionally at very high standing in India, is a recipient of many awards, and academically very active, training hundreds of young budding doctors, and above all, saving lives of thousands of patients. She has been responsible for numerous innovative initiatives. But above all, as far as I'm concerned, and many of us, she was very instrumental in giving us 18 more years of Dr. Tolani after his horrific accident. Today, we are here to hear from her a few words of wisdom, which will probably make us all better understand when we should seek medical help, when is the right time to do that, so that we can keep ourselves and our families healthy and safe for a long, long time. So thank you for being here, Prachi. It is really an honor. I am so happy to have you here today addressing our team at Tolani's. And over to you. Thank you.
Thank you so much. Thank you, Sujata, for such kind words. I still remember, I never thought it was 22 years ago, but it has been a long time since we've got introduced to each other. And I'm so glad that me and my team could contribute to the future of Maritime Institute since then.
Thank you.
In real words. So it has been my passion always to talk to general public about the importance of timely intervention. So I wholeheartedly accepted your invitation to come and talk to all the group involved in Tolani family and various endeavors. So I'm really glad to be here with all of you. I would just like to share my screen and then start the talk. Is that visible?
Yes.
Right. So just now, Mr. Rahul mentioned about COVID, and what we have gone through was a bad dream, and it was real bad for all the healthcare workers. And the world came to know about the importance of critical care or intensive care or acute care. In other words, we can say people were really running from pillar to post to find out a good ICU bed during those times. So it is really very important that all of us intensivists, people didn't even know this word, isn't it, Sujata?
Yes,
that there is some
absolutely.
such kind of speciality. Now it has come to forefront and how it is helpful in saving lives. So saving lives, as you can see in this picture, can be on some TV series we could have seen like Flying Doctors and all, but it is in real life that the doctors and the right timely interventions can save lives. So as you mentioned, I'm going to talk for next few minutes about timely medical care practices which can really help save lives. I'll not go towards COVID today. It is too much. All of us have talked about it and heard about it. But there is life other than COVID as well. And let us find out how we can do the best to get timely help from the medical care. So a human being is a very funny organism, isn't it? We observe many conflicts and many controversies in our behavior. So let us find out what exactly these are. And I'll ask Rahul to run a short poll for all of us so that quickly we will come to know about what is in our mind before we start going towards our topic for today. Over to you, Rahul. So how many of us want to live longer? Please answer yes or no. Yeah, and let us be very quick in our responses so that we can go further. Well, there are a few people who don't want to live longer, apparently. All right, so can we go to the next question? How many of us, sorry, the second question. So how many of us want to take help of medical care to live longer? Please answer. Oh, the arm with no is extending. Right. So there is a 50-50 or rather 45-50, 55. Okay. Okay. Right. So the next question, please. So people who don't want to take help of medical care, I'm sure they want to be self-dependent, Atmanirbhar for their own health, and that's a very good news. How many of us are scared of death? Oh, that is quite heartening to see that many of us are not scared of death. Well, it is true that death is a part of our life or the life on earth. Mhm. That's interesting. Okay. The next question. There are these few questions which I have posed for our own introspection. Next. How many of us have made provisions for emergency medical treatment? For example, savings or medical insurance. We always keep money aside for the education of the son if son is born in the family. We always keep money aside for a daughter's wedding if the daughter is born in the family, isn't it? But how many of us keep money aside for our own health? That's good. I'm quite happy to see that many of us are very responsible people. Next question, please. How many of us watch daily diet and exercise and deal with stress management? It is as good as having medical insurance, you know. All of you understand. It is more important than having medical insurance to have proper control on our own day-to-day life and lifestyle. Great. I must say, Sujata, I'm impressed with this lot of people.
Me too.
Okay, good. Next, please. Yeah, just one more question, I suppose. How many of us feel that once we are sick, the doctor is responsible for our health outcome? Most of the times we find that patients totally hold doctor responsible for their survival or non-survival. But again, I feel that people in this group are very wise and very mature. I'm sure the doctors don't have to fear here, isn't it? The next one, I think the last one. How many of us feel that once we are, no, this is done, the next one? Right. Now, this is a very important question. How many of us feel that ICUs can save lives? Well, so yes and no. And I think both the answers are correct. But if it is reached in time and if underlying disease is reversible, the ICUs can definitely help save lives. And that we have just heard during this introduction made by Dr. Sujata, isn't it? I think let us stop this poll over here and go back to deliberations. So human being is a funny organism, as I mentioned. And then what is the fun is that we want to live longer and use medical help to get better. But many of us are scared of death. We just don't want to die. We just don't want our loved ones to die, isn't it? But there is a denial to accept the illness and seek timely care. And that is definitely observed in all socioeconomic strata. We want to have best of the care, but do not want to spend for it. That is very true in Indian scenario, isn't it? औषधांच्या किमती एवढ्या का, डॉक्टरला एवढे पैसे का द्यायचे, हॉस्पिटलला एवढे पैसे का द्यायचे आणि कसा खर्च एवढा येऊ शकतो ह्याचा आपल्याला नेहमी प्रश्न पडलेला असतो. सो वी हॅव टू रिझॉल्व इन आवर ओन माइंड and we have to make provisions for it. We do not understand that like medical insurance, timely health checks, daily exercise, diet and stress management is important. And once we are sick, we hold the doctor responsible for the negative outcome. And in India, we beat up the doctor. So that is not the way. And I'm really happy to be here with this group who is very mature and very, very balanced and responsible. We do not understand that ICUs are there to help us and we have to seek help in time. Then the ICUs can be the best. Well, let us just talk about the statistics of causes of death in India. As you can see here, it's a visual impression that how heart and circulatory disorders make the largest of it. Then the cancers have come as a second largest group. Respiratory disorders, nervous system disorders, but none of them are devoid of probable death or probable morbidity or affecting the quality of life. For example, diabetes or various types of infections and simple things as transport accidents, where India is one of the topmost countries. Not only that, even pregnancy and birth related injuries and deaths are also high in our country. So with all this, don't you think we have to think to our own mind how we can all prevent this and how we can all treat this? In younger age group, when it is analyzed, can you imagine that suicide can be one of the first number one cause of death? And it is very important that all of us keep talking to each other. And if somebody is saying that expressing negative thoughts, should not neglect it, should be watchful for taking the person out of that. This is especially true in younger age group. But in a younger age group, injuries, accidents, and even cardiovascular diseases are increasing. So we have to remember that none of the age groups are devoid of threats and such situations. And the baseline causes, which in fact we invite with our own hands, is basically tobacco, being overweight and obesity, accidents, and infectious diseases. So most of these things can be avoided, and that is what we have to remember. But if anything out of this actually happens, we should seek medical help immediately. Analysis of the causes of lifestyle related diseases and cancers also can tell us the same thing, that these things should be prevented. So coming to the other part of it, that health expenditure per person, if we try and take out the world statistics, you can see over here that country like Brazil and Russia is having more provisions to spend for health, whereas India, it is minuscule. And you can see even public spending is minuscule out of that. And still 70% of people in India have to spend out of their own pockets. So taking all these things into our consideration, we have to think how to prevent the serious illnesses, and if at all there are any signs and symptoms, how we should go ahead and what we should do. I think it was not nice to talk about death and death related things right at the beginning of this talk, but I think that was most important to get the perspective. But still, life is beautiful. So let us come back to the beautiful life on earth. And then the management of emergencies becomes an integral part of any society, any primary care, any hospital, any healthcare. So what are these things? So many different things you will hear. अरे कालपर्यंत तर चांगला होता, अचानक काय झालं? हो, दम्याचा आजार होता, पण माहित नाही एक दिवसात कसा खराब झाला. So all these things, we can come across and we hear from people. घरातल्या घरात पडल्या, पायाचं मांडीचं हाड फ्रॅक्चर झालं, हॉस्पिटलमध्ये गेलं आणि 2 दिवसात गेल्या. So all these things are very important for all of us to understand that there is a potential for early correct treatment and prevention in early stages of diseases, because it gives us very short time in case of emergency. You must have seen in case of emergency, break the glass. These are the notices everywhere. And then what is to be done after that? And that is what all of us have to understand. बाल्टिमोरला इन अमेरिकेमध्ये एक ॲडम्स कोली इन्स्टिट्यूट आहे. तिथे सगळ्यात पहिल्यांदा ही गोल्डन अवरची कन्सेप्ट सुरू झाली, सुवर्ण काळ ज्याला आपण म्हणतो. सो 60 precious minutes concept by Adams Coley. So in which he mentioned that time is life, and if you are critically injured, you have less than 60 minutes to survive. You might not die right then. It may be after a few days, but something has happened in your body that is irreparable if it is not reversed within the first hour. So there is a golden hour between life and death. And that is what we will try to understand. What are the common medical emergencies encountered in general practice? असा एक सर्वे केला गेला होता की कशासाठी लोक आले बाबा तुमच्याकडे, काय झालं म्हणून आले, चक्कर आली, चक्कर येऊन पडले, किंवा क्षणभर बेशुद्ध झाले, किंवा झोपून उठल्या उठल्या ब्लड प्रेशर ड्रॉप झालं, ऑर्थोस्टॅटिक हायपोटेन्शन म्हणून चक्कर आली, एखाद्या औषधाची रिॲक्शन आली, किंवा दम्याचा अटॅक आला आणि खूप दम लागायला लागला, खूप जास्त ताप चढला, शुगर खूप कमी किंवा जास्त झाली, फॉरेन बॉडी ऍस्पिरेशन, आपल्याला माहितीये लहान मुलं काहीतरी दाणा खातात किंवा पैशाचं नाणं खातात आणि कुठे छातीत अडकतं, सीझर्स म्हणजे फिट्स किंवा फेफरं येणं जे म्हणतो आपण, हार्ट रिलेटेड प्रॉब्लेम्स अँड अदर मेडिकल इमर्जन्सी. सो ही कॉमनेस्ट कारणं आहेत ज्यासाठी एखादी व्यक्ती जनरल प्रॅक्टिशनर कडे जाते आणि मग फटाफट कधी कधी पुढे हॉस्पिटल पर्यंत न्यावं लागतं. अशा घटना कधी कधी न सांगता येतात. So all of us have to be prepared to handle the emergencies and be clear in your mind that basic life support certification can be done by all of us, even the lay public. So even in the institutes like yours, there can be certain people who are trained in basic life support, and there should be equipment for basic life support available in all the institutions. There should be one medical emergency room available there. Be certified in advanced cardiac life support also is quite possible. In your own location, तुम्ही जिथे कुठे असाल तिथे कुठे इमर्जन्सी इक्विपमेंट आहे, काही लागलं तर आपल्याला कुठं काय हाक मारावी लागेल हे आपल्याला माहित पाहिजे. Know your patient. When you are working with your colleagues, you know somebody has some disease or somebody has certain problems. So be aware, be a buddy, be a good buddy. And when something happens wrong or goes wrong, you should have a drill that you can do in your own institution. So react to possible emergencies very, very promptly. Syncope म्हणजे काय? चक्कर येणं, giddiness. Maybe you just stand up from the floor or from the chair and you feel loss of balance. Or somebody can actually fall on the floor. But whether that person has had cardiac arrest or just giddiness, we don't know. So we have to learn certain things, and which will come across too in next few slides. So चक्कर येणं हे अगदी कॉमनेस्ट आहे. खूप उपास तापास केले किंवा झोप झाली नाही, प्रवास केला, काही उलट्या झाल्या, जुलाब झाले, डिहायड्रेशन झालं, तर टिपिकली पीपल प्रेझेंट विथ एपिसोड ऑफ गिडीनेस. So which is a most common emergency. Almost 30% of adults can face it sometime or the other. आपल्याला माहितीये पुष्कळ 26 जानेवारी किंवा 15 ऑगस्टचे कार्यक्रम असतात, परेडमध्ये उभं राहिल्या पण लोकांना चक्कर येते. सो अशा ह्याच्यामध्ये चक्कर का येते? सो ड्युरिंग दॅट टाइम देर इज रिड्युस्ड ब्लड सप्लाय टू द ब्रेन. सो व्हॉट इज द मोस्ट इम्पॉर्टंट थिंग दॅट यू नीड टू डू? मेक द पर्सन lie down on the floor so that the blood circulation to the brain is re-established again. But it is not very simple because syncope can be or giddiness can be a predisposing or pre-presenting feature to various things. It could be just psychological like anxiety, or it can be hyperventilation syndrome. म्हणजे कोणतरी खूप जोरजोरात श्वास घेते घाबरल्यामुळे तरी सुद्धा असं होऊ शकतं. पण नाहीतर ऍक्च्युअल हार्ट अटॅक, शुगर लो होणं, चक्कर येणं, फिट येणं, या सगळ्या गोष्टींमधून किंवा इम्पेंडिंग ब्रेन स्ट्रोक या सगळ्याचं मॅनिफेस्टेशन चक्कर येणं हे असू शकतं. So if somebody has a significant giddiness, it should never be neglected. It has to be properly analyzed. कधी कधी चक्कर येण्याच्या आधीची सिम्पटम्स पण आपल्याला लक्षात घ्यायला हवेत. सिव्हिअर नॉशिया, उलटी सारखं वाटणं, एकदम गरम वाटणं, घाम फुटणं, डोळ्यापुढे अंधार येणं, हार्ट रेट खूप फास्ट किंवा खूप कमी होणं, अशा सगळ्या गोष्टींवरती आपण लक्ष ठेवायला पाहिजे. Whether that person is having only psychological problem or there is some underlying problem. And as you can see over here, legs should be elevated. You can do that even when somebody is lying on the floor. So by this, the blood circulation towards the brain and the heart improves. So this is called as Trendelenburg position. So we all have to remember in such situations what is to be done. In such situations, we should also be able to make the person smell. आपण कांद्याचा आवाज देतो की नाही, अमोनिया स्मेल, अँड देन सडनली द ब्रेन कॅन वेक अप. पण नाहीतर आपल्याला ऑक्सिजन सुद्धा द्यायला लागू शकतो. आपण आपल्याला काय काय इक्विपमेंट अवेलेबल ठेवायला पाहिजे आपल्या इन्स्टिट्यूटमध्ये त्याच्याबद्दल सुद्धा बोलूया. There should be a team of emergency medical people or people who are trained in BLS around in the institution, and there should be always a few cupboards at various places which will contain emergency equipment or emergency drug. चक्कर येऊन कोणीतरी पडलं तर आपण काय बघायला पाहिजे? पल्स, नाडीचे ठोके मोजता येणं हे आपण सगळ्यांनी शिकायला पाहिजे. We know that we can check it on our hand or near the wrist. But other than that, you can also check it on your feet. You can, if it is not palpable on the peripheries of our limbs, then we can check it what is called as carotid. आपल्या गळ्याला जेव्हा आपल्या श्वासनलिकेच्या बाजूला आपण हात लावतो तर आपल्याला एक महत्वाची रक्तवाहिनी pulsating दिसते. So we should be able to check that also. All of us should learn measuring it. As it was mentioned earlier, now all of us know how to use the pulse oximeter as well, which is a boon. And we should have multiple pulse oximeters available, and we should be able to check the pulse rate and the oxygen levels. काही वेळेला असं होतं की there are known asthmatic people किंवा कोणाला तरी श्वास लागतोय, pneumonia किंवा infection झालेलं आहे, and that person is just unable to breathe and he is choking. So during such asthma attack, we should be able to treat a person on the site by positioning the patient upright, using a bronchodilator inhaler. You are all aware of this type of inhalers and the devices like this, which are called as spacers or the nebulizers. And these are simple equipment which we can make available in our own institution and train certain personnel about how to use it. Asthma can get precipitated because of simple things like dust. किंवा रंगकाम चाललं असेल तर त्या रंगाचा वास येतो strong. People who are sensitive to that can develop asthmatic attack. So this concept of golden hours is applicable to various conditions like trauma, myocardial infarction, that means heart attack, stroke. Stroke म्हणजे आपण पॅरालिसिसचा अटॅक म्हणतो ना, ब्रेनला रक्त पुरवठ्यामध्ये अडथळा येणं. आणि सेप्सिस म्हणजे काय, तर शरीरात एखादं इन्फेक्शन होणं, सिव्हिअर पेन, सिव्हिअर ताप येणं आणि इन्फेक्शन सगळ्या शरीरात पसरणं किंवा आपण म्हणतो विषभिंत, इन्फेक्शनचं विष शरीरात भिंत. So if there is severe infection also, in all these conditions, there is a great importance of golden hour management mentioned in large body of evidence in all medical journals and textbooks. So we will just go through all of this in short, quickly. As you can see here, if there is a severe accident or trauma, then there is a trimodal death distribution. जर खूपच मेजर इंजुरी असेल तर लगेचच्या लगेच 1 तासाच्या आतच माणूस दगावू शकतो. But otherwise, within an hour, there is a second peak. Within the second hour, there is up to 2 hours, there are early deaths. And then there are delayed deaths. So our goal of the whole health system and the social system is to avoid these deaths which occur in less than 2 hours. So there can be a lot of reasons. There are certain medical terminologies mentioned over here, which you may not understand, but then we teach all this to even our nurses and junior doctors and emergency medical doctors. And we try to tell them how to look for them. And that is a primary survey. आपल्या इथे कोणीतरी जर का खेळताना इंजुरी झाली, उंचावरून पडलं किंवा व्हेकल ऍक्सिडेंट झाला, तर आपण सगळ्यांनी काय बघितलं पाहिजे? सो देयर इज अ प्रायमरी सर्वे इन विच यू सी हाऊ द पेशंट इज ब्रीदिंग. वन ऑफ द मोस्ट इम्पॉर्टंट थिंग्स इज cervical spine. As you know, if there is a head injury, associated cervical spine injury is also very, very likely. So while shifting this patient, all of us have to be very careful. First of all, we should apply a collar to the neck so that the neck doesn't move in wrong way, because that can lead to lifetime loss of power in both all 4 limbs and even the respiration. So we should have a cervical spine collar available in all the institutions. We should watch for breathing and ventilation. If required, we can even give artificial ventilation to these patients, bedside or even on the floor. Circulation, we have to watch for peripheral pulses or whether the patient is becoming cold. If there is any obvious bleeding, we should tie a tourniquet to avoid bleeding or stop further bleeding, or give a lot of pressure to the site from where the bleeding is occurring if it is external bleeding. We should always look for any disability. A patient is unable to move one hand or unable to speak. So neurological status we need to understand and make highlight of. And exposure and environment control. Suppose somebody has gone into a swimming pool and got a heart attack. So you have to first of all get the patient out. and put on the floor and assess what is happening. So why all these things are important? I know certain institutes may be away from tertiary hospitals. So in such situations, or when you call for an ambulance, a responsible person should be able to communicate with the medical person who is going to come and attend to your patient. Okay, I'm not going to go in all the details, but there can be certain life-threatening chest problems or lung problems which will lead a person towards death. So while treating these, we must see to it that the patient gets enough oxygen, and we can have not necessarily oxygen cylinders, even oxygen concentrators available at various locations. There can be blood in the brain because of blunt trauma to the brain. And that reminds me of the story which you heard at the beginning. And this is highly respectable grand old man of Shipping and Maritime Institute who actually made it good for 22 years after having something like this. And it was as trivial fall as it can happen from a very small height. And he was on blood thinning agents like ecosprin, which are commonplace. And maybe because of that, there was a collection of blood inside the brain. Luckily, he reached us within the golden hour. He was observed very closely, and there was a surgery to remove the clot. And rest is the history, as you know. He had fruitful 18 years after the life-threatening accident he had, and only because of timely medical help. So all of us have to remember to take timely medical help. What do we do when the patient reaches? We assess the patient of trauma for all those points which I have already told you before. But in addition to that, we also do ultrasonic examination. We do scans of the brain. We do x-rays of the chest, abdominal ultrasounds. And then we try and resuscitate the patient. What do we mean by resuscitation? म्हणजे एखाद्याच्या लाईफ गेलेलं आहे शरीरातून ते परत आणण्यासाठी ज्या फास्ट ऍक्शन्स घेतल्या जातात त्याला रिससिटेशन म्हणतात. सो सलाईन तुम्हाला माहितीच आहे, ब्लड प्रेशर नॉर्मल ठेवण्यासाठी दिली जाणारी औषधं, ऑक्सिजन, कृत्रिम श्वासोच्छ्वास. सो या सगळ्या गोष्टी इन्स्टिट्यूशन मध्ये, एखाद्या मेडिकल इन्स्टिट्यूशन मध्ये केल्या जातात. ब्लड द्यायचं का, IV सलाईन फक्त पुरेसं आहे. So in all this, it is extremely important that the person reaches the right medical facility fast. And remember, none of the medical practitioner can deny the emergency treatment. At least in initial phase, he or she has to stabilize the patient and then send forward to a tertiary or high-level medical institution. But during all this, we have to remember the caretaker has to take care of himself or herself too. Let me tell you a story, real story. We had this gentleman, 68 years old male with diabetes. सकाळी 8 वाजता ते चालत चालत मार्केटमध्ये गेले भाजी आणायला. आणि जेव्हा 10 मिनिटात भाजीवाल्यासमोर उभा असताना त्यांना जाणवलं दॅट डावा हात त्यांचा हलत नव्हता आणि डाव्या पायात मुंग्या यायला लागल्या होत्या. ही कुड नॉट स्पीक प्रॉपरली, ट्राईड टू स्पीक. पण लकीली त्यांनी शेजारच्या माणसाला अवेअर केलं की काहीतरी मला होतंय. आणि इट इज सो ग्रेट टू ऑब्झर्व द हेल्पफुल पर्सन. Within 5 minutes, his relatives were contacted and they were aware about the situation of the patient. Ambulance was called for, which arrived in 20 minutes. And this gentleman was brought to us. Now, what is happening over here? All of us have to be very much aware of all these signs which help us for identification of stroke. So, is face looking uneven? चेहरा विडावाकडा झालाय का? एखादा हात उचलत नाहीये का? बोलण्यात फरक पडलाय का? या सगळ्या गोष्टी केअरफुली वॉच करून आपण आधीच लक्षात घेतलं पाहिजे की देयर इज अ पॉसिबिलिटी ऑफ स्ट्रोक or brain attack, in other words. And these patients, if they reach hospital in time, can actually get saved from lifelong paralysis. So all the institutions which are working at international standard have standard protocols which are applicable to critical care of stroke. So that is also called as stroke code. So as soon as the patient reaches, what we do very fast history taking. तर बरोबर आलेल्या माणसाला आपल्या नातेवाईकाची मेडिकल हिस्ट्री पण माहित पाहिजे. की ब्लड प्रेशर होतं का, आधी काय झालं होतं, डोक्याला मार लागला होता का, डायबिटीस होता का, औषधं काय होती. सो इट इज इम्पॉर्टंट फॉर ऑल ऑफ अस टू लर्न टू कीप आवर मेडिकल रेकॉर्ड्स इन प्लेस. इमर्जन्सी कधीच सांगून येत नाही. त्यामुळे आपल्याला सगळ्यांना माहिती पाहिजे की आपली मेडिकल हिस्ट्री आपण कुठेतरी लिहून ठेवली पाहिजे, फोनवर ठेवली पाहिजे, क्लाउडवर ठेवली पाहिजे आणि आपल्या सगळ्या जवळच्या लोकांना त्याची माहिती असली पाहिजे. So what is recommended if a patient comes to us with impending stroke? Within 10 minutes of arrival, there should be a stroke team which is available as emergency physician and even the neurologist, and get an urgent CT scan. So CT scan should be done within 25 minutes of arrival. Within 45 minutes of ED arrival, there has to be proper interpretation of CT. नुसतं एखादं इन्व्हेस्टिगेशन करून उपयोग नाही, त्याचा अर्थ काय आणि त्याच्यावर उपचार काय हे कळलं पाहिजे. सो दॅट एक्सपर्ट हॅज टू बी अवेलेबल. अँड इफ द पेशंट इज reaching within 1 hour of hospital arrival and within 3 hours from the onset of symptoms, then we can actually give medicines to dissolve the clot that is happening inside the brain. You have seen the patients who have moved around or lost the quality of life because of loss of power in one side of their body. And you can imagine how important it is to reverse it. So even up to 3 hours to 4.5 hours, we can reverse this by giving certain medications which are fully available in India. And you can see over here in our casualty, the patient arrived at 8:40, stroke code activated, stroke team arrived at 9 a.m. Patient was in imaging, CT scan, and then all of us are aware that time is brain. If we don't waste time, we can save the brain. Per minute of ischemia, the following are destroyed: 1.9 million neurons. जर 1 मिनिट ब्लड सर्क्युलेशन थांबलं ना ब्रेनचं, तर जवळजवळ 2 मिलियन न्यूरॉन्स डेड होतात. यू कॅन इमॅजिन. सो हाऊ मच इट कॅन बी ड्रेडफुल. An average stroke after 10 hours, man ages 30 years. So you have lost 30 years of your life. So you imagine how important it is to save life at early time, early interval. So in this particular patient was found to have a major blood circulation problem on the right side of his brain. And then he was given the life-saving medication to reverse the stroke. So symptom to door interval was 30 minutes, door to physician 7 minutes, door to imaging 22 minutes, door to needle 35 minutes when the blood clot dissolving medicine was given to him. So this was a successful example of this patient who walked home after 3 days with no neurological deficit. So it is such a great thing which keeps all of us medical practitioners going because of job satisfaction that we get. Similarly, there is a concept of golden hour in heart attack. So we know heart attack येतो म्हणजे काय होतं, तर आतमध्ये ब्लड सप्लाय बंद पडतो, रक्तवाहिनी बंद पडते. आता सगळ्यांना माहिती आहे एन्जिओग्राफी, एन्जिओप्लास्टी, ब्ला ब्ला ब्ला, सगळ्यांच्या तोंडावर असतात हे शब्द. पण त्याचा फायदा होण्यासाठी आपण काय केलं पाहिजे? वी हॅव टू टेक द पेशंट टू द हॉस्पिटल इन राईट टाइम. सो इफ समथिंग हॅज स्टार्टेड ॲट होम, यू हॅव टू गो टुवर्ड्स a general practitioner who has to identify it correctly and call an ambulance to go to a well-equipped hospital for complete diagnosis and proper treatment. So all this diagnostic staircase has to be very, very fast. These days, we can even do thrombolysis in the ambulance.
Wow.
With telemedicine, there are so many advantages. COVID has taught us telemedicine also, and acceptance of telemedicine also. So sitting at my hospital or my ICU, I can guide a doctor who is in the ambulance about what is to be done for a patient in the ambulance, because the time is heart muscle over here. So all these things can be useful only and only if we reach in time. But you can see here in one of the Indian surveys, how it had shown. It is quite a few years ago. Now the situation has improved quite a lot. But how many hours are spent before the right medical effort is done? पण ह्याच्यामध्ये आपल्या सगळ्यांचाही तेवढाच वाटा आहे ना. क्रिएटिंग अवेअरनेस इज सो इम्पॉर्टंट. पण आपल्याकडे कसे, कशासाठी बरं डॉक्टर सांगत असेल? डॉक्टरलाच त्यात पैसे कमवायचे असतील, हॉस्पिटललाच पैसे कमवायचे असतील. But most of the times, it is really being done according to international protocols. So please remember, we have to have our awareness levels also, because we should not be in the denial mode. We should not be in a non-acceptance mode. We have to have early recognition. काय झालं बाबा? नाही, काल दुखलं होतं डॉक्टर पोटात. पोटात? नाही नाही, छातीत दुखलं होतं. पण मग ते मी इनो घेतला, सोडा घेतला, मग बरं वाटलं. मग आज आलो. So after 12 hours, already the window of opportunity has gone completely. So it is important that we take help of medical system early. And what is important is yearly checks. Don't be suspicious that yearly checks are told to make money. It is not true. Yearly checks or 6 monthly checks are very important for us to get awareness about our own health. Same thing is true about diabetes. Diabetes can kill immediately, or diabetes can kill over the years. But it is definitely not a disease to be neglected, because hyperglycemia can lead to emergencies which can take you to ICU. But sometimes it can be so slow, and we realize it only when the kidney has failed, or the stroke has come, or the heart attack has occurred. So it is very important. Hypoglycemia is even worse, because hypoglycemia can just drop the patient unconscious if sugar levels go below 70. So it is very important to be aware of these things. We also have to be aware about acute bleeding. Halli pushkar patients blood thinners varti astat. Drugs like Ecosprin or even advanced blood thinners are there. One patient came to me the other day who was noticed to have 3 fainting attacks since morning. And when he came there, even after asking a lot of questions, he would deny everything, any history. And then one of the doctors kept on asking him about the color of the stool he was passing. And then he admitted that last few days he has been passing black color stool, dark stool. And that is where he was losing blood in the body. So antiplatelet or anticoagulation drugs can sometimes precipitate chronic blood loss, which ultimately can lead to syncope or giddiness or unconsciousness. Okay, so that needs to be treated with. So be aware to be watchful for unexpected small bleed also. And then of course, all of us know about the cardiac arrest. Cardiac arrest can actually occur. We know that. But there are so many experiments now and so many things known, the scientific evidence is there, that if we give a good quality CPR in basic life support, it can save life. There was a world-renowned boxer who was going on his morning walk, and he was called by the crowd to come and help resuscitate a patient who had had a fall during his morning jog. So this gentleman went there, and he, with all his might, started giving cardiac massage and also gave a good thump on the chest of that patient, and that patient actually recovered. This gentleman said, "I have seen patients losing consciousness because of my thump. This is for the first time I have seen somebody coming around and improving after my thump." So the right thump and right cardiac massage actually can save life. So all of us can learn these techniques. So when somebody falls unconscious, make sure that environment is safe and the rescuers and victims both are safe. Check for cardiac arrest, check for responsiveness. First of all, you have to thump or tap on the cheek of the patient and ask how you are. If there is no response, you know that something is going wrong. If there is breathing there, effort there, or no, or there is a gasping or labored breathing, you try and find out pulse within 10 seconds. So if you don't find anything of that, you really have to take a serious cognizance to all that. And then CPR and the first aid, we have to learn and start using. आपण पुष्कळदा पाहिले automated external defibrillators. You can find them on airports or important with auto instructions there. So important thing is that we all should learn this. YouTube, there are lots of YouTube videos available, or we can make even a training course for the team on site. If you are alone with no mobile phone, then leave the victim to activate the emergency response. Otherwise, send someone to begin CPR immediately and use the AED as soon as it is available. In case of unwitnessed collapse of children or infant, give CPR for 2 minutes before leaving the victim. So in various situations, you have to learn the techniques. And the chest compression should be given at the center. Remember, heart is not on the left side in the chest. It is right below our sternum. So give the compressions in the ratio of 30 compressions and 2 artificial breaths. So you would see all these things on YouTube. Beautiful videos are available, and you can learn how to give cardiac massage, how to hold your hands on the sternum of the patient, and how to give safe cardiac massage. And it is, the acronym is CAB, circulation, airway, and breathing. So we have to start with cardiac compressions first, then try and make the airway position, the neck position should be made in such a fashion that the airway remains open. And if the patient is not breathing, you can give mouth-to-mouth ventilation. With current times, if we find it to be very unsafe, then we can use certain masks to give mouth-to-mouth ventilation. But what is important is intermittent drills to practice the emergency situations are important, because otherwise we forget about it. So in the office or any organization, there should be a group of people who can handle the emergencies. And then such type of pocket masks are available, which you can keep available handy, and you can use this by non-returning valves. So you can give a good respiration to the victim. And this is what is showing you how to hold the neck and how to give the position. It is called as head tilt and chin lift maneuver with a jaw thrust. You can use such type of devices to give artificial ventilation, artificial breath to a patient. So there are certain protocols. I don't think I'll go in all the details, but if you are using AED, automatic defibrillator, then these are the positions where we should apply the pads of the defibrillator. As soon as you apply the defibrillators, you will also know what is the rhythm, how is the heart working, and you can actually take a photo and send it to the doctor also. And if this type of various graphs will come. So in summary, have emergency equipment readily available. Office personnel should know where the emergency equipment is, consider practice scenarios, and BLS protocols have changed to CAB, that we have to remember. When in doubt, administer O2, oxygen, and you should have oxygen concentrators available. When in doubt, get an appropriate medical consultation on video consultation. It is a good idea to recommend medical follow-up. एखादा इव्हेंट घडला आणि तो पेशंट बरा झाला तर काय नाही, काय झालं नव्हतं असं म्हणून सोडून द्यायचं नाही. You should do a proper medical checkup following the event. So what is the various equipment which we can make available even at the remote sites? The simple oxygen cannulae and oxygen masks. Pulse oximeter has become now available and known to everyone. These are the oxygen concentrators. And simple monitors also can be made available. But there are more than jewelry. I think people are using wearable devices nowadays, but they should not be just as a jewelry. They should actually be utilized to monitor the patients, and that can be conveyed to a doctor. Simple devices on phone also, you can actually use certain apps to take an ECG, basic ECG. So all these things can be utilized in current times very, very wisely to monitor the patient and keep a watch till the patient reaches a good medical facility. And certain things can be made available, as I had mentioned it to you, inhalers with spacers, nebulizers, glucometers, and certain emergency injections at the site. But there is no answer to this. From where am I going to get so much money at the 11th hour? So as much as it is important to be aware of medical conditions, it is equally important to be prepared either in terms of medical insurance or in terms of having your own liquid savings. This last point I would like to mention is about sepsis, a golden hour in sepsis. Sepsis means what? Sepsis means any infection, may it be malaria, dengue, may it be influenza, may it be COVID, or any diabetic infection anywhere in the body. If it spreads beyond certain limit, it affects the whole of the body and all the organs in the body. And then that can become a life-threatening situation. So it is our job to find it out in early stages that the patient is likely to get into overwhelming infection in the body. Because if you see over here, this is an Indian survey which has shown that patients who have severe sepsis, ICU mortality is more than 40%. If patients who don't have sepsis, in patients who don't have sepsis, the mortality is much less. So ICU can help if we find it out early and report to ICU early. So sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to an infection. Why somebody can get it and somebody doesn't get it, we still do not know, but we should at least be able to find out. And there are very simple 3 things. Altered mental status. घरातली एखादी आपल्या एल्डरली व्यक्ती आहे आणि जरा ड्राउझी झालीये, काहीतरीच बोलते असं वाटायला लागलं तर डोंट निग्लेक्ट इट. रेस्पिरेटरी रेट फास्ट. ऍडल्ट्स मध्ये रेस्पिरेटरी रेट 20-22च्या वर असेल तर that is disproportionately fast. It is as good as the patient is jogging marathon, you know. So respiratory rate should be observed, which we can all measure bedside. And hypotension, blood pressure, जर 100च्या खाली असेल तर परफ्युजन प्रॉब्लेम्स किंवा सर्क्युलेशन प्रॉब्लेम्स आहेत ते लक्षात घ्यायला पाहिजे. या 3 पैकी 2 पॉइंट्स जरी दिसले कॉमन मॅनला तरी हे लक्षात घ्या की हा आपला पेशंट सिरियस कंडिशन कडे चाललेला आहे. सो इट इज व्हेरी व्हेरी इम्पॉर्टंट दॅट वी रीच सच पेशंट व्हेरी अर्ली टू अ हॉस्पिटल. इट इज कॉल्ड ॲज SOFA score. So what is done by taking this patient to ICU or to save lives in sepsis? Early identification and diagnosis is very important. Then early antibiotics and IV fluids. So these are very simple things that are being done, but for which we have to reach our patient to a medical scenario, medical facility very early. And then there are certain other warning signs which even a common person, school going child also can monitor. थर्मामीटर कसा वापरायचा आपल्याला सगळ्यांना माहित पाहिजे. थर्मामीटर काखेमध्ये किंवा तोंडामध्ये वापरू शकतो. हार्ट रेट कसा मोजायचा, पल्स रेट, पल्स कशी बघायची हे आपल्याला माहिती पाहिजे. ब्लड प्रेशरची खाली ऑटोमॅटिक मशीन्स मिळतात, ती आपल्याला सगळ्यांना वापरता आली पाहिजेत. श्वासोच्छवासाचा रेट किती आहे, एका मिनिटात किती वेळा श्वासोच्छवास घेतला जातोय ते आपल्याला मोजता आलं पाहिजे. आणि पेशंट अलर्ट फुल्ली कॉन्शियस आहे की नाही, का कन्फ्युज्ड आहे, का ड्राउझी आणि लिथार्जिक आहे, उठायला नको म्हणतोय, किंवा आपण हाक मारली तर बघत नाहीये, चिमटा काढल्यावर सुद्धा हालचाल करत नाहीये, का कशालाच रिस्पॉन्स नाही आणि कोमामध्ये आहे. या सगळ्या गोष्टी आपल्याला बघता आल्या पाहिजेत आणि डॉक्टरला डिस्क्राईब करता आल्या पाहिजेत. या खूप महत्वाच्या गोष्टी आहेत. रिमेंबर, सम स्मॉल इन्सिडेंट्स और स्मॉल manifestations that occur can only be the tip of the iceberg. जसं काही सिंकोप, चक्कर येणं, इतर काहीतरी होतंय का, किंवा ट्रान्झिएंटली चेस्ट पेन होऊन गेले, डोंट टेक इट लाइटली. Try to find out if at all there is anything underlying. There may not be also. And if it is not there, don't blame the doctor. If it is not there, it's well and good. But we have to check it and confirm it that it is not there. So watch for the signs and symptoms and get yourself checked. What is done in the ICU? पुष्कळांना असं वाटतं की नको ICU मध्ये जायला, कशाला ICU जायचं. But remember, ICUs are there to save lives. And I have large pool of patients who have come out successfully from ICU and have never required any medical attention in future again, especially in India where the population is young and some life-threatening event occurs. We can actually take out these patients out of that emergency and they can have fruitful lives from the point of view of nation as well. So it actually gives you a second lease of life, and ICUs can help you. There is no doubt about it. पण आपण ICUचा योग्य वापर कसा केला पाहिजे याचा विचार करूया. एक म्हणजे being prepared and do not deny. जर गरज वाटली ICU जाण्याची तर जरूर जाऊया. एखादं मोठं ऑपरेशन करायचं असेल आणि ऑपरेशन नंतर पेशंटला 24 तास ऑब्झर्व करायचं ICU, येस, वी हॅव टू ऍक्सेप्ट इट. इट इज टू अवॉइड इमर्जन्सी. दुसरी गोष्ट काय पाहिली पाहिजे की ज्या काही आजारामुळे आपला पेशंट आजारी पडलाय त्याच्यामध्ये इम्प्रुव्हमेंट होण्याचे चान्सेस आहेत का नाहीत. Whether there is reversibility or non-reversibility of the illness. Based on that also, we should decide to use the ICUs wisely. There is no point in spending all of a fortune on ICU treatment if the underlying disease is irreversible. So we have to use our conscientiousness and use the scientific principles in discussion with the doctor. How to choose a good ICU is very important. पुष्कळ वेळेला लोक काय म्हणतात की नको नको जवळच्या ICUत गेलेलं बरं, जवळच्या दवाखान्यात गेलेलं बरं. That is not important. What is important is what is the condition from which patient is suffering and where the best treatment for that disease is going to be offered. That is how we have to choose a good ICU. So it is all our own responsibility as well to understand science. That doesn't mean just to Google and ask point blank questions to a doctor. Please remember that. So understand science, have a scientific attitude, and also understand the limitations of science. Biological sciences still cannot make everybody immortal. Please remember that. But we have to work within the limits to improve the quality of life and improve the fruitfulness of human life. So life is very precious and don't miss the golden hour. Thank you.
That was awesome. Awesome. Great.
Thank you. Stop sharing. Right.
Thank you so much, ma'am, for conducting such an eye-opening session. In fact, we do not know most of those things, and many times we get confused exactly what to do in these kind of situations. So it was really very interesting and eye-opening session, I must say. We have a couple of questions sent by our participants here. The first question is by Mr. Ganesh Ingade from Tolani Maritime Institute. And he asks, can anyone from any background do the life-saving courses? Is it possible?
Yes, it is possible. In fact, in other countries, you can enroll yourself. But I'm sure in Maritime Institute, it must be available, Sujata, isn't it? That people who are going on the ship, I think it is one of the prerequisites to know the basic life support system. But we can actually make these courses available and we can teach basic life support to various people who are enthusiastic and willing to learn.
I think everybody should be very familiar with these things. Absolutely.
Yeah.
There's no question about it.
Yeah, anything can happen at home also, or your neighbor also. Anybody can need it, you know.
The second question is from Ankush Pawar, and he asks how to reduce, he has written a Hindi word that is balgam. I think that is sputum.
Phlegm.
Yes. Yes, yes.
Okay.
So I think these personal questions we can take later, but there are simple things like taking steam inhalation and gargling, which itself can help it. Okay.
Okay. Dr. Hema Mehta has asked an interesting question. She says, does irregularity in our routine affect our health?
Yes, definitely. Because there is something called as diurnal rhythm in the body. You must have heard that there was a Nobel Prize given to one of the life science scientists who had worked on understanding the circadian rhythm in the body. So there are so many things that are happening in our body which go according to day and night. Various hormones are secreted. Sleep is required for proper healing of the body. So all these things very important. So occasionally, if you are straying, it is all right. But otherwise, most of the times you should have a proper routine.
Nitin from TSCL, he asks, what's the difference between heart attack and cardiac arrest?
Heart attack means there is a part of the heart muscle is at jeopardy or it is not receiving proper blood circulation and oxygen. Cardiac arrest means standstill of the heart. Heart is not functioning at all.
Mr. Sangram Puhan from TMI, he wants to ask, as a layman, how do we distinguish between acidity and cardiac problem?
See, acidity most of the times happens something related to your food habits. And there is a kind of burning, whereas chest pain because of heart is most of the times like compressing. People describe it as like an elephant standing on my chest or something like that, you know. But having said that, sometimes it is difficult to distinguish. So it is always better to err on the side of taking an ECG or taking an opinion of the doctor for that.
Dr. Rasmita Mohanty wants to ask, what are the causes of persistent giddiness and vertigo?
There can be various causes. Giddiness is such an important symptom where you need to check various systems, right from starting from ear or inner ear, or cervical spine, to drop in blood pressure or very high blood pressure, or very low sugar or very high sugar. There are so many other things, and even including psychological problems. So it has to be assessed properly. There are various tests also for that. And then treat the particular underlying cause. Yeah.
Dr. Shrikant Madivale from TMI wants to ask a question. He says, what are the basic requirements needed in an ideal ambulance?
That is a very good question. An ideal ambulance is as good as an ICU room on the wheels, ICU cabin on the wheels. So whatever is available in an ICU cabin should be available in an ambulance, because anything can happen anywhere on the way, especially if you're transporting a seriously ill, unstable patient. So in other words, there has to be oxygen, availability of monitors, availability of artificial ventilation, and not only the equipment, the man or woman behind the machine is equally important. So a trained personnel, the nurses, even the ward boys, how to move the patient, like accident, if it has happened, and as I told you that you have to protect the cervical spine of the patient. So you have to have ward boys or the attendants who know how to handle in such situations. And in current times, there has to be availability of the communication in an ambulance to the baseline hospital.
Lakshmi Pandya from TCC wants to ask, is occasional tremor in speech, hand or leg normal?
Yeah, it can be normal. It also depends on your stress level, if it is occasional.
Mayank Shah from TMI wants to ask, how physical exercise and normal walk should be done or regular daily or regulated daily to avoid excess load on heart?
Right. So most of the times what happens that we become gradually laid back, and then something stimulates us and we suddenly start with a spur of action, spur of the moment, and we start excessive exercise. And where the heart and rest of our system is not ready to bear that much of load. And we have heard so many incidents in recent times that people otherwise hale and hearty go in the gym and then suddenly have cardiac arrest, etc. So it is important that you should gradually increase the level of exercise. Then exercise should be of various types. It should not be only walking or only weightlifting, or that there has to be flexibility and endurance and the cardiac endurance. It's muscle endurance and cardiac endurance. So there has to be a combination of all these three different types of exercises in combination or in rotation over the week. So it should not be like on 1st of January, you suddenly started with 2 hours of exercise with a New Year resolution.
That's good. We'll take 2 last questions, ma'am. Mr. Pratik Tiwari wants to ask, how can we understand the relation between food and mind?
Sorry, say it again.
How can we understand the relation between food and mind?
Food and mind. Okay.
Yes.
So I think we will have to have another lecture for that. And it is not only the relationship between food and mind, but there is so much to be talked about mind and our health.
And there is another question from Raman PV from Tolani Shipping. He wants to ask, how important is it to complete the medication course? Many times after a couple of days medication, we become all right.
So it is very important that you complete the course of medication, no doubt about it. But I always tell my patients that blood pressure or diabetes is not like cough and cold. That so many patients come to me after 3 months of initial prescription and say, "हाँ, आपने तो 1 महीने के लिए लिखा था, तो बंद कर दिया." So it is not that. You have to be in touch and in consultation with your doctor for what is to be done with the medications. Number of times it so happens that patients are from some village or some other city, and the medical profession, I mean, the chemist calls whether I should give medications because it is the 6th consecutive month that the patient has come to get your prescription. So in our country, people misuse the prescriptions a lot. So it is important that they should be in proper connection and communication with the medical practitioner, their own doctor.
Okay, thank you so much ma'am, for answering all those questions so patiently.
Thank you.
So a couple of comments, if I may, right?
Sure.
Prachi, thank you very
Yeah.
much. You
You're welcome.
very nicely covered. I think this whole golden hour thing was so important for everybody to hear that.
Absolutely.
Whereas on one end, clearly the idea is for all of you to be able to understand this concept of golden hour and intelligently use this information for yourselves and for your families and friends. Okay. This is definitely something that all of you should understand, but obviously this doesn't mean that you would ever look at taking it to the other extreme, that every little small thing that happens that you think and you're scared that, oh my God, this is going to be a heart attack or this is going to be a stroke. You have to understand a little more and ensure that you are appropriately taking decisions. So we should not be like a pendulum swinging. But couple things that came to my mind as you were talking and as the questions came around. I think what I used to find very important during what I call my past life in my medical days, okay, the best thing that any patient doctor relationship can happen and be created is for the patient to completely understand his or her illness.
True.
A
Very
well-educated patient is probably the best thing to keep a patient out of hospital. Okay. So I think all of you must be very, and I'm sorry to say it this way, but there are times that many doctors feel that, acha, just tell them, unko bolo, bas ye dawai khao, aur sab theek ho jayega. Why you are having that medicine, what you are going to do with it, etc., etc. That is your prerogative to ask the doctor to understand. It is not good to be ignorant about your illness and just accept, okay, doctor ne bola ye 5 din ye goli khao aur bas finish. Okay. You need to understand because you are the best person who can help your body. If you don't understand your illness, nobody can really help you to that extent. So it is very important for you to take that responsibility on you. I think this is really an important piece of patient education, patient understanding of their illnesses and their body. The second thing, when you talked about this, the ICU, why should we go to ICU? Because there are a lot of people who are very scared of going to the ICU. A lot of people have conceptions about artificial measures to continue life, things like ventilators, things like intravenous fluids, things like feeding tube, etc., etc. I think you made a very important point that if supposing somebody has irreversible diseases, terminal cancers, etc., etc., where you know that your outcome is not going to change overall, that's one thing. But otherwise, in other situations where we are not dealing with any terminal illnesses and not dealing with any irreversible situations, it actually behooves everybody to make sure that they get treated with whatever today's technology allows us to treat people. Yeah. And we have come a long way in the medical profession. There is so much that can be done. even if it means going on the ventilator. You have a pneumonia. You just need to have a support for 4 or 5 days, and you can come off the ventilator and you can be back to normal, as Dr. Prachi already mentioned. I think it's very important to understand where to draw the line, because many people are very scared of this whole concept. I don't want to receive any kind of artificial means of survival. But there is a huge role for these artificial means of treatment, or support systems to the body in situations which are reversible. There is a huge role for that. And I think that is one thing that people should also, understand very, very clearly. Yeah. Okay.
Absolutely right. But sometimes Google is misleading. Please remember
Very.
that also. Whatever is said by Google Baba is everything not correct.
Right, right.
So try to develop a proper scientific attitude.
Yes. So Rahul is
Yes.
with that. Yeah,
Thank you so much, ma'am, for your valuable inputs. Prachi ma'am, it was really very informative session, and we have learned a lot of things. And I sincerely hope that this is not the only session that we will have. In fact, this is just the beginning, and we will have many more sessions from you and a lot of guidance, so that we can make ourselves aware and we can help ourselves in difficult situations. I'd like to thank Dr. Sujata Naik Tolani from bottom of my heart on behalf of all the staff members, Tolani Group, and everybody for arranging this kind of informative talk for all of us and taking care of us. Thank you so much, ma'am. I'd also like to thank Mr. R. Kumar sir for attending the session.
Yeah.
I'd like to thank all the principals of TCC, TMI, and Chaitanya International School, all the faculty members, office staff members, and of course students for attending the session today. Thank you so much for from my side, and with this we'd like to stop the session over here. Thank you so much, ma'am.
Thank you.
Thank you. Thank you so much.
Thank you, Prachi. Thank you so much.
Thank you.
This
It was nice to be with Tolani family.
Thank
That
you.
was
Thank
nice.
you.
Thank you.
Yeah.
Thank you. Bye.
Take
Wish you
care.
all a very happy and healthy new year, and hopefully we come out of COVID now.
Yes.
Thank you.
Okay.
Someday it will happen.
It will happen.
Yes,
It will happen.
Yes. Yes.